This session will look into the different components of the generic results framework and will introduce some key terminology. The highest level of results is represented by the goal, which refers to improved status of the target population we are working with. Some examples of goal statements include decreased malnutrition rates among children under 5 years of age, or decreased mortality rates among neonates, etc. This is the level that we aim to or contribute to achieve in the long term, usually beyond the time frame of the project. Goals are usually expensive to measure. They require large surveys carried out at infrequent intervals by usually large organizations. The next level is the strategic objective, and this is the level where we define the types of results that will increase the use of key practices and services among the target population. Here we are referring to things like increasing the participation of children in quality early childhood development programs, or increasing exclusive breastfeeding for the first 6 months of age, or timely and appropriate immunization of poultry as part of key agricultural practices, etc. So all the results at the strategic objective level are directly related to the interventions that the project will deliver. Those behaviors, services, or supplies that we know from evidence will have a direct influence in the use of practices and services among the target population we're going to work with. Let's take a closer look at the IR level, and let me begin with intermediate result 3. This is the demand side, those behavioral determinants of using the key practices or services. These behavioral determinants include social norms, knowledge, skills, attitudes, beliefs, and the like. The supply side is composed by the first two intermediate results, IR1 and IR2. IR1 focuses on access and availability of key services and refers to the likelihood that a person and service will actually meet, either through the person going to the service, or the service going to the person, or meeting midway, and the necessary supplies and services will be available. Access not only refers to the geography, but also to the socioeconomic factors that can serve as barriers to care or service delivery. IR2, which includes the concept of quality, it's a bit complex and refers not only to the technical quality of the services, but also to the people's perceptions of quality and acceptability. Not always the same as technical quality. Nonetheless, good perceived quality facilitates use. Last but not least, the enabling environment facilitates high demand and high supply. Environmental factors are important at all levels, from the community, its mobilization or capacity or social norms, to the capital city with the adoption of favorable policies. Within the results framework, the strategic objective is the level that relates to the use of interventions, the what practice, what commodity we want beneficiaries to use. The intermediate results are important steps to achieve through the chosen delivery strategies, and this is the how we propose to increase use. Finally, the goal is the why, the overall purpose for which we designed the program. But because the strategic objective level focuses on the increase of use of key practices and services, the results framework is one that uses a behavior-centered approach, making the best use of our resources towards maximizing the use of key practices and services among the target population. Let's review some key terminology associated with the results framework. First, the goal is the ultimate purpose or aim of a project, often not directly measured. The strategic objective, also known as the SO, is the highest level result a project can materially affect, usually a statement about the use of key services or behaviors. The intermediate results, also known as the IR, are lower level results that must occur to achieve the strategic objective, one or more results that directly inform strategies. Let's take a look at an example of a results framework. In a child health program, the goal will be to reduce mortality rates among children under 5 years of age, while the strategic objective would be to increase the use of key maternal and child health and nutrition practices and services. But what do we mean with this type of practices? Let's take a closer look. When we say to increase nutrition practices, we refer to increase immediate breastfeeding or timely introduction of appropriate complementary foods. When we say to increase nutrition services, we refer to vitamin A supplementation for children or postpartum vitamin A, etc. When we say to increase health practices, we refer, for instance, to hand washing at appropriate times or recognition of danger signs, etc. And when we say to increase health services, we refer, for instance, to measles immunization, deworming campaigns, appropriate referral care, etc. Going back to the results framework of the child health program, the intermediate results would include increased knowledge and acceptance of key maternal and child health and nutrition practices and services, increased access to and availability of key maternal and child health and nutrition services and supplies, increased quality of key maternal and child health and nutrition services, and the enabling social and policy environment. Let's take another example of a results framework for an agricultural program, where the goal would be to increase household food availability, while the strategic objective would be defined as increased use of key agricultural practices and services. And again, what do we mean with practices and services for agricultural programs? Let's take another closer look at this. When we're talking about practices related to the production, we refer to crop diversification, improved seed selection, use of locally produced poultry feed, etc. When we're talking about services for the production side, we might refer to animal and poultry vaccinations, irrigation, high yield seed provision, etc. When we're talking about practices related to the marketing element, we might refer to post-harvest storage or post-harvest processing. While when we're talking about services for the marketing element of this agricultural program, we might refer to up-to-date market information, distribution networks, credit, etc. Going back to the results framework for this agricultural program, we see that all the 4 IRs relates to the increased access to and availability of key agricultural services and supplies, increased quality of those key agricultural services, increased knowledge and acceptance of key practices and services related to those agricultural practices, and the enabling social and policy environment. Let's take another look of another example, in this case for the early childhood development programs, in which the goal is defined as children learn and develop to their full potential, while the strategic objective is defined as strengthen children's participation in quality ECD programs, while the 4 intermediate results again relates to increased access to ECD programs for children and their caregivers, improved quality of those ECD programs, improved community capacity and support to protect and promote ECD as part of intermediate result 3, and strengthening policies, capacities, and resources for ECD programs as part of intermediate results 4. This is yet another example, but of a multi-sectoral program that includes a goal in terms of reducing hunger and malnutrition, with 3 sub-goals in terms of adequate food availability, adequate access to food, and the optimal food utilization. When we're talking about the optimal food utilization, for instance, the strategic objective would be to increase the use of key maternal and child health and nutrition practices and services, for which 4 intermediate results are described in terms of increased access to and availability of those key maternal and child health and nutrition services and supplies. IR2 defined as increased quality of key maternal, child health and nutrition services, while the IR3 is defined as the increased knowledge, attitudes, and skills regarding key maternal and child health and nutrition practices and services and the enabling social and policy environment, all of them pointing to a behavior-centered intervention that relates to that increased use of those key practices and services.